and Dr. Venugopal. I'm so proud that he has created such a fantastic emergency medicine network in Kerala. And that's saving large number of lives. And the best part is that it's not just happening in MIMS or Aster. It's beyond that, much beyond that, because he has trained significant number of paramedics as well as doctors who are now across the country as well as even outside the country. And they are all involved in spreading this message as well as saving lives. So the whole concept of emergency medicine, earlier we used to call this as casualty, and there used to be a general practitioner sitting there. That whole thing has changed now and transformed actually. And the whole team who are involved in this, I really appreciate what has been done. We run a lot of courses. I don't want to go into the details. And this particular conference is having some 14 workshops or so in different areas. And I understand that everything has been completely subscribed and the registrations were closed, showing that the interest of the people to know. From all over India and even from outside of India, there are a lot of delegates who have come in. I welcome all of you and thank you for this participation. We are doing something which is really saving lives. We say that in healthcare we always save lives, but here it's really happening. We are saving large number of lives by doing a proper emergency medicine and emergency care. So thank you all for coming to Calicut and being part of this. And we hope that we can take it to the next level and we can really become the center of excellence in India as well as internationally for emergency care. I once again congratulate Dr. Venugopal. I call him Venu. He is my student. I had the privilege of teaching Dr. Venu when he was a student in the Calicut Medical College. He has grown so much and he has reached such heights and feel so proud about him. And of course, many others who are there who are running this program. May God bless the conference as well as all of you participate in this. All the best. Thank you. Jai Hind.
Thank you so much. We'll start off the event by lighting the lamp. I would like to invite Dr.Mohanan Kunnummal sir to please come on to the dais for lighting the lamp. Dr. Bipin Batra, Dr. Farhan Yasin, Dr. Venugopal sir, Dr. Gopakumaran Katta, Ms. Sheelama Joseph ma'am, Dr. Abraham Mamin sir, Dr. Apunni and Dr. Kirti. Also, Dr. Ramesh Basi, sir, please come on to the dais.
Yes, sir. Yes, yes.
ഞാനൊരു രമേഷൻ ചെയ്യും.
Thank you all. On this remarkable evening, I have the honor to welcome and introduce our prolific and influential chief guest, Dr.Mohanan Kunnummal, the Vice-chancellor of Kerala University of Health Services and President, Association of Indian Health Science Universities. Sir, your works ensured that your followers and students should believe in Robert Baden-Powell's words, "Try and leave this world a little better than you found it." Dr. Mohanan Kunnummal, he hails from Kannur and he did his MBBS and MD from Government Medical College, Trivandrum. He was a professor at the Department of Radio Diagnosis, Thrissur, for a long time. He holds a number of positions, including he was a member of Medical Advisory Council, he was a member of Specialist Board Radio Diagnosis, a special invitee, COVID-19 Advisory Committee for Government of Kerala, and so on. His academic and service excellence is extraordinary. Dr. Mohanan Kunnummal bagged many laurels. He received Best Doctor in the state by Government of Kerala, Dr. P.J. Alexander Memorial Oration Award of Kerala IMA, and so on. His scientific presentations in medical conferences are numerous. He has guided and completed 19 research projects and guiding 3 ongoing projects. Dr. Mohanan was State President of Kerala Government Medical College Teachers Association and State Vice President for Indian Medical Association. His scientific publications in international journals are marked as the best. He was a fellow of Indian Academy of Medical Specialties and also was an executive counselor of Asian Oceanic Society of Radiology. We are very grateful for your gracious presence here, sir. I request you to address and enlighten the gathering. Thank you.
Good evening. Chairman of Aster Healthcare, Dr.Azad Moopen, the father of emergency medicine in Kerala, India, my dear friend Venugopal, Dr. Bipin Batra, former Executive Director of National Board of Examination and the person who launched DNB program in emergency medicine, Padma Shri Subardo Das, Professor Sachin Menon, Dr. Gopalakrishna Karta, Dr. Asma Bibi, pioneers in emergency medicine, respected faculty members attending this conference, and my dear students and ladies and gentlemen. I'm extremely happy and proud to stand before you in this conference, Aster International Emergency Medicine Conclave 22, and I thank the organizers for giving me an opportunity to be here. Let me at the outset thank the Aster Medicity Healthcare for organizing such a conference on this day. This day, May 27th, is the International Emergency Medicine Day. And you have done a wonderful job. Thank you. Thank you for that. 2 years have passed after the COVID-19 and we were in a long dark tunnel. Now we are seeing the bright light of hope. And COVID taught us many things, and it brought health and healthcare profession in the center stage. And also it brought emergency medicine, the most important medicine that will save thousands. In fact, tireless work of emergency medicine professionals, the doctors, the nurses, and the technicians saved a large number of lives. And in between, we lost many of them also. So in this meeting, in this international conference, I salute the emergency medicine professionals. I salute and thank each one of you. Thank you. Thank you very much. I've been a practicing radiologist for the last 3 decades. And definitely I know the importance of emergency medicine. In stroke, we say, time is brain. And that means in an established stroke, every minute it is said you will lose 1.9 million neurons every minute. Time is brain. And in heart attack, there again, every minute you will lose the muscle. Their time is muscle. So time, you have to race against time, and that's why the emergency medicine becomes so important. In trauma, you say about golden hour. It's not golden hour, it can be golden minute. It can golden minute. So such an important area, unfortunately, it was not given importance by the society. It was not given importance by the government, but because of the efforts of the pioneers who are sitting here, including my great friend Venugopal, the society has recognized it. The government has recognized it. In fact, the National Medical Commission has come out with a statement that if you want to have a medical college, open an emergency medicine department. And so in 2022 to 23, this year, if your medical college is a medical college, there must be an emergency medicine, otherwise shut down. That is the level at which the government has taken a position. And these emergency medicine departments should have 30 dedicated beds, multiple ICU beds, all the state-of-art equipments, and 1 professor, 1 associate professor, 1 assistant professor, and 9 senior residents. Largest number of senior residents in any department in any medical college. 12 people. And how many medical colleges you have? 607 as on today. 607 into 12. How many emergency medicine professionals you should have? 7,284. 7,284 emergency medicine professionals are required in India as per the NMC, otherwise some of these colleges will have to be shut down. And how many emergency medicine professionals, medical colleges we are producing? Under MCI system, we have got 58 colleges producing emergency medicine professional. And how many seats? 187. And National Board, started by our Dr.Azad, also produces 187 seats. So altogether, we have 374. 374 you produce every year, and you require 7,300. This is just for medical colleges. But medical colleges are not India. We have 773 districts in India. So each district, I would say, every district hospital should open an emergency medicine department. Not to employ the emergency medicine professional, but to save me and you. To save each and every one of us. We have Dr. Appundi here. Because Venu has established an emergency medicine department, Dr. Apurni is sitting with us, and Apurni is lighting the lamp. And we don't want people like Apurni to disappear because there is no emergency medicine department in one district, in one college, in one hospital. And now this has been realized by the government. Wonderful. But then it has to be perpetuated. For the time being, they're agreeing to have an anesthetist or a physician or an orthopedician or a surgeon to work as an emergency physician for some more years, provided they got 2 years training in emergency medicine. Stopgap arrangements, that is the only way to do. In fact, few years ago, as Dr. Venu was saying, Calicut started emergency medicine MD. 2 other colleges also started emergency medicine MD in Kerala. And I was the medicine dean of the university at that time. And all these students came to us that our degree is not recognized. We have passed, but it is not recognized. I took it up, I was an MCA member also. I took it up with the MCA. They said this, that, this. There were a lot of excuses, lame excuses. I raised the issue in the general body. Then also there was the issue. Finally we said, why don't you go to the court, otherwise nothing will happen. We pressurized the council in such a way that one fine morning they agreed and they recognized. And now look, now they're saying that everybody should have an emergency medicine department. So changes happen. So you cannot blame anybody. The mindset is like that. But you have to change the mindset of people. And therefore, I salute you for changing the mindset of India. That's a great thing you have done. Wonderful thing. Now, emergency medicine is not a one-man speciality. You need supporting group. As a single doctor, multiple doctors, 9 residents cannot do anything. You need emergency medicine technicians. You need emergency medicine nurses. You need supportive system. Unfortunately, that also is not addressed. We also are not conducting any courses. I have no shame in saying that Kerala University of Health Sciences is not conducting because nobody else also is conducting. Nobody in India is also conducting, and no university is also conducting. So we are ready to conduct such courses. That's what I want to tell you. We are ready to conduct such courses. Emergency medicine technician course, graduate degree in emergency medicine, and postgraduate degree in emergency medicine nursing. Because there is a basic nursing is there, emergency medicine. So I seek your support and help in designing a course, and we will roll out the course. And with the national education policy, universities at liberty to have any number of courses. And also, we can have highly specialized certificate courses in emergency medicine. There are, I was told that there is something about wilderness medicine. Why not? Why not? So such things can be considered. Please bring up with the proposals. University has got an academic council, and your university member is sitting here with you. So we will definitely do that. Now, one very important thing I just want to highlight before I close my speech. Doctors are stressed. Even during the COVID, we all had so much stress, and it is said that the longevity of life of an average doctor is less than an average Indian. It's a reality. It's a reality. So this has to be addressed. And this stress level will be very high among the people like emergency medicine people. Maybe an armchair radiologist may have little less. But of course, radiology is also no more armchair. It is interventional radiology, and there my youngsters are having very difficult. Maybe I didn't have that problem those days. And therefore, how do you address that? We have to address the problem of stress, work-related stress among doctors. We are having a program. In the coming 12th, Kerala University of Health Sciences, in collaboration with Psychiatric Society and Indian Medical Association, is having a program in Thrissur, a small program to address the issue of stress and stress-related problem, work-related stress of the doctors. And I request that you emergency medicine people definitely will have stress. Probably you may not, or you may be overlooking it. Please discuss that. Please discuss that. Collaborate with us. Let us have solutions. Let us have programs. And let us live longer like our other brothers and sisters in the country. With these few words, I close my talk and I declare this program inaugurated. Thank you. Thank you very much.
Sir, it would be great if you could stay back for a moment. I would like to call upon Dr. K.N. Gopakumaran Karta, Dean, Dr. Moopen's Medical College, Wayanad, to honor our beloved chief guest. Sir, it would be great, Gopakumaran sir, it would be great if you could share a few words with us.
A very good evening to you all. Most Honorable Vice-chancellor, Kerala University of Health Sciences, Mohan sir, and all the distinguished personalities who have assembled here in this wonderful evening. At the outset, on behalf of Dr. Moopen's Medical College, it's a momentous occasion. So I'm so thankful and grateful for inviting me to be here, one among you, in this academic feast. We are a part of this umbrella. I'm so grateful Dr. Curry and the entire team was there in Dr. Moopen's Medical College in 2 days. We had a wonderful session of toxicology and wilderness medicine. I'm so grateful to Dr. Venu and his entire team for considering us also as a part of this great academic event. As Dr. Mohan sir rightly mentioned that just for the existence of a medical college, the emergency medicine has recognized and identified as one of the most essential departments. As rightly mentioned, there is a huge gap between the demand of emergency physicians and the present available physicians. We are having a breathing space of nearly about 1 year to fill the professorship and other faculty from the allied specialties. After that, we have to find out the specialized persons in this concerned specialty. So there's a great hope that the emergency medicine is emerging out as the most wanted, identified destination in the medical specialty. As a part of the medical college, we know that once the patient is getting admitted in the hospital, he is passing through all the sophisticated specialty. You have enough and more time to treat the patient, to address the problems and all. But hats off to you, you are not having the time. You have to raise against the time in the decision making, designing the treatment, diagnosis, identifying the most apt investigation on this particular patient. It's actually a tremendous task where you have to think ahead of the time. So a great, great salute to all emergency physicians who have gathered here. I think that this is actually a wonderful session. A lot of carry-home messages are there, and a lot of protocols have been drafted in this particular session. Once again, I express my gratitude for inviting me to this occasion. All the best for this international EmerGenZ conference. Thank you, Dr. Venu and his team. Jai Hind.
Thank you so much, sir. I once again greet the people who graced today's inaugural. I now take the privilege to introduce the distinguished and highly esteemed guest, a visionary, Dr. Bipin Batra, who is the current chairman of Assessment and Internal Quality, BTA, as well as the president of ASL Institute. He is one of the faculties of Famer Institute, BTA, and the chairman of Scientific Board, Rejoice Foundation. Your presence today holds a positive vibe that's more powerful than your prescriptions. Dr. Bipin Batra is MBBS, DMRD, DNB holder, and an FRCS Fellow, Royal College of Surgeons, Edinburgh, UK. Also a PG Diploma holder in Health and Hospital Management, Fellow of Royal Tropical Institute, Netherlands. They say he's the best physician who is the most ingenious inspirer of hope, and Dr. Batra is the one. He's instrumental in bringing DNB emergency medicine in India. He served as Executive Director for National Board of Examinations, India, and contributed a lot in the development of academics in radiodiagnosis. We are very pleased to have you here today. Kindly share your valuable thoughts with the audience. Thank you, sir.
Good evening, everyone. The Honorable Chairman of the Aster Group, Dr.Azad Moopen, the Chairman of EmerGenZ 2022, Dr. Venugopal, the esteemed Vice-chancellor of the Kerala University of Health Sciences, and my fellow radiologist, senior colleague, Dr. Mohanan, the Dean of Dr. Moopen's Medical College, Dr. Kartha, Dr. Bhasi, Mr. Farzan, and all the esteemed dignitaries of the dais, all the distinguished participants today, my dear valued delegates and postgraduate students. Thank you for having me today for this wonderful event. Emergency medicine discipline has always been a home for me. Starting my career as a radiologist and further diversifying into medical education, I could see the way our patients and healthcare systems over the last 25 years had struggled actually to provide the care in acute areas, the areas of acute and intensive care. And I have in my discussions always classified the growth of emergency medicine in India into 4 phases or 4 generations. The first generation of emergency medicine has been the CMO era, when a person confined to emergency, he started his career as a medical officer and retired as casualty or chief medical officer there, spending 30-35 years in that room and assembling all the consultants in the department to see a patient or refer them, and maybe with the help of senior residents able to provide certain level of care in the emergencies. Now this gave way to second generation of reforms when we had MD emergency medicine launched in the country. And around 2008, the Medical Council of India approved the MD emergency medicine as a discipline, but there was no light about who would classify as faculty for emergency medicine. It's a classical chicken and egg situation that we are launching a department, but we don't have criteria for faculty, whether faculty from medicine, anesthesia, surgery could reclassify themselves and rechristen themselves as consultants in emergency medicine. So that problem continued, and it continued for a fairly long time. I think the last I recall was just before the MCI gave way to its new avatar NMC, they set up a committee under the then chairmanship of one very distinguished Vice-chancellor to solve this problem. But 12 years was a long way. Then in between came the phase 3 of reforms. As Dr. Mohanan stated that medical colleges is not India. Indian healthcare is not born entirely out of medical colleges. Medical colleges and medical universities are the key pillar. Now, a greater part of our healthcare delivery system lies in what is government control, the public primary health centers, the network of district hospitals. And over a period of last 40 years, a transition, 70% of our services has been provided by a large number of private practitioners and corporate hospitals. And literature has witnessed that 70% of our healthcare services in secondary, tertiary, and quaternary care still flow from these areas. Now, this is one area where the National Board always had deeper connect. And what we needed was right kind of connect with the fraternity and the right kind of expertise to roll out a program. So I had the proud privilege of working very closely with Professor Venugopal and the entire team members of SEMI, IndusEM, and other members, professional societies from India and abroad, who were very keen to support this milestone. Each one of us and each one of these societies and professional associations contributed their bit, and 2014 was a milestone when the discipline of DNV emergency medicine was approved by the National Board, and 2016 the Gazette notification. It took me 2 years of hectic lobbying with the government to have it included in the Schedule 1 of the Indian Medical Council Act, so that the degree is fully recognized for faculty positions as well as practice purposes. So it was a long journey. And the course did expand thereafter, And today, as my esteemed colleague stated, we have around 400 plus positions in MD and DNB combined together in emergency medicine. But the demand of emergency medicine, or I would say acute care physicians, far outweighs the production side of it. So what we are looking forward to is the fourth generation of reforms. Now what exactly are these fourth generation of reforms which could take us to where we will be able to serve the society, and we are able to save every life which touches us in our day-to-day practice. So we have to look at strategies which are firstly address the capacity building in the physician space. Friends, today we have almost 1.25 million physicians registered on the rolls of state medical councils, and the National Medical Register of India has close to 1.25 million physicians, out of which approximately 1.1 million physicians are active physicians. They are below 65 or 70 years of age. And approximately 8% of that are past 70. So even if we assume the cutoff of 70 years of age, we have around 1.1 million physicians in the Indian Medical Register. 2.5 lakh doctors, which is approximately 23% of India's workforce today, medical workforce, is underemployed to non-employed. The number of aspirants in NEET PG today stands at 1.8 lakhs every year. And only a fraction of this will enter into post-graduation. And we have 3 batches preceding to the batch which is passed out, and a couple of batches succeeding, which are not doing anything. They are focusing only on the MCQs. And there's a large amount of talent and energy which is available in this space. And this is an area where we need to target and undertake capacity building. So the fourth generation of reforms must look at programs addressing the capacity building in acute medicine, which is beyond the MD and DNB emergency medicine, and the globalization of the Indian physician. Globalization of Indian physician has been a long-standing phenomenon. Indian diaspora of physicians has established themselves and proven themselves the world over in any healthcare system, whether it is US, whether it is Canada, whether it is NHS UK, whether it is Australia, whether it is Gulf. So we have pockets of excellence, or rather I would say large pockets of excellence created by the Indian physicians over there. And we are presently, in my new avatar, I'm actively working to strengthen and establish this axis, whereby we are able to create a earn, learn and return kind of mechanism, whereby we are training the candidates in India, creating opportunities for them, job opportunities for them in the developed markets with a limited time placement over there. And these physicians, once they have spent their time over there, they have completed their professional development by acquiring the requisite qualifications, be it the MRCM or FRCM. These candidates can come back and serve the motherland. Now, besides these approaches, what we need to focus on is non-physician based approaches, which the Aster group of institutions has been doing it very well. And I'm very delighted to understand from none other than the chairman of the Association of Indian Universities of Health Sciences that they think with an open mind about creating non-physician based approaches for capacity building in pre-hospital healthcare and augmenting the capacity in the emergency medicine departments. So I think the future for emergency medicine, the spotlight on the future for emergency medicine and acute medicine has once again been highlighted with the advent of the dark tunnel which we have seen in the last 2 years. And the world has realized once again the importance of acute and emergency medicine. So I look forward to working closely with each one of you, and I think as part of my closing vision or a closing remark, the day is not very far away when we are going to see a dedicated university for emergency medicine in the country that would cater to innovation and capacity building at all levels in emergency medicine. And I think Calicut is a very right kind of place in India when it comes to innovation. Family medicine or primary care is another area where the country has been lacking, and the Government Medical College Calicut has always shown the torchlight to the rest of the country. The Department of Family Medicine till 3 years ago was the only working family medicine department in the country. And this state of Kerala, God's own country, a small state with 14 districts, is today home to 30 medical schools, 30 medical colleges. And some very interesting observations I have when I have been conducting the NEET examination and analyzing the NEET results from a different perspective. Which is the state which has maximum participation in NEET examinations? Obviously, the state which has maximum graduates, they will be the one. But compared to the number of districts which Kerala has as a ratio, more per thousand number of aspirants for the NEET PG examination. The number of candidates in the per thousand ratio who have been successful compared to rest of the country, Kerala stands in the either first or the second position in the last 5 years. And lastly, in the first 30,000 positions which are scored by any state, Kerala has been the consistent leader for 9 years in continuation as far as the national level examinations are concerned. And this, I'm not speaking, this is the national board data which is there, and the data is for the rest of the country to see. So this state has really showcased what it takes to establish a global center for medical education. And I think the state will continue to lead the rest of the country and the rest of the healthcare systems with the wisdom and collective energy. Thank you very much.
Sir, could you stay back as well? I would like to call upon Dr. Ramesh Basi, Director of Medical Education, Aster MIMS Calicut, to honor Dr. Bipin Batra. And it would also be great if you could speak a few words for us.
Missed out one thing. I think we all must congratulate Dr. Moopen's Medical College for completing 10th year. I believe this year Dr. Moopen's Medical College is completing the 10th year of their glorious batch. Congratulations.
Good evening, everybody. It's an absolute privilege and honor to be here addressing you. I thank Venu, my friend, for giving me this opportunity. I have seen over the last 2 decades how Venu has transformed the emergency care in Kerala. Not only in Calicut, but this has spread all over Kerala. And thank you, Venu, for that great vision. And now we have seen what that sort of innovation has changed in the medical field, especially in the emergency care in Kerala. A great venture, Venu. Keep on doing the great work. And I thank everybody here for witnessing this dramatic change in the healthcare happening in India and Kerala. Thank you.
The world is full of diamonds and gems, and we are having some of them today to build this event. I'm extremely overwhelmed to get this opportunity to introduce a legend, Dr. Suprato Das, winner of one of India's highest civilian awards, Padma Shri, for his work on highway trauma care. Co-founded Lifeline Foundation along with his wife Sushmita after surviving a life-threatening accident in August 1999 on one of India's busiest highways with the aim of reducing the annual highway deaths in India. The only Indian to be honored with the Asian EMS Lifetime Achievement Award and also named as the country's best-known EMS expert. Dr. Das is an inspiration for many as the accomplishments he has made are not an easy task. Mrs. Sushmita, who is here today, has been a strong pillar of support and initiation for all the great works done. Her valiant struggle, backed by her strong determination, brought her all the way where she is now. She has served as executive editor of Asian EMS Journal and has been a recipient of Red and White Bravery Gold Award, also recognized by Limca Book of Records in 2005. Sir, madam, you both have made the nation proud. We are very pleased to have you both here. Sir, it would be great. I welcome you to the dais to share your words of wisdom with us. Thank you.
Thank you for the nice words, and thank you for having me here. Respected Chairman Padma Shri Dr.Azad Moopen, Dr.Mohanan, Kunnummal, Dr. Khatra, Dr. Bipin Batra, my friends, Dr. Sachin, Dr. Sai, and Dr. Narendranath Jena, Chairman of the Emergency Medicine and the father of medicine in Kerala, and I would say in India, Dr. Venugopal, faculties, delegates, dignitaries here, and the young generation of emergency medicine and EMS leaders. Good evening to all of you. Before I go ahead, I would like to ask every delegate here, every faculty, every student, to get up and give a standing ovation to Dr. Venugopal and the organizers of this event. Please understand, this is the first gathering that we are having post-COVID. And Sushmita and I always believe that Dr. Venugopal is a personality who lives EMS. He is synonymous with EMS in word and spirit. And it's a very emotional moment for me that he's invited me here. Thank you. If anyone deserves to be a Hall of Famer for EMS, he should be the first one. I request Dr. Sai in SEMI to perhaps start a Hall of Fame and have him this. That's the biggest honor that we can give him for all that he has done. Thank you, Dr. Venu. It's a month short of 23 years that Sushmita and I started our journey into EMS. At the time, wanting to contribute back to society for being alive, following an accident, we started this network of ambulances that Dr. Venu always says, community EMS. But when we started off, we did not know around the country that there were other crusaders working towards the same goal. And then we met Venu and Tomoresh, TVR and Zulfi, Narendra and Chandru, and many others. Sushmita and I have been lucky to have such support. We would not be where we are without that support. Our work has been a work of continuous disruptive innovations, and I use the word disruptive because we have done a lot of changes. Emergency medicine and EMS, what we have done in the last 20 years, I don't think any other discipline of medicine has done so much progress. Changing right from the highway trauma care systems, changing its ambulances, the curriculum of emergency medicine, getting it institutionalized across states and colleges, a single unified helpline number, getting Gujarat to be the first state to have an EMS Act, and I hope and wish Kerala soon becomes the second state to have an EMS Act. And that is what disruptive change is all about. We are into one more disruptive change. We realized during COVID that Ayush doctors form a huge chunk of medical professionals out in the field. And along with the Ministry of Ayush, we signed an MOU during this Global Ayush Summit that Mr. Modi wanted to go through. The aim is to get these Ayush doctors to be first responders, not learn allopathic medicine, not certify them, but provide them hands-on training on simple things like primary assessment, secondary surveys, C-spine stabilization, CPR, hemorrhage and suturing, all those things. We have started this program in Gujarat, Rajasthan and Madhya Pradesh, and I realize Kerala has huge opportunities of training these Ayush doctors to be first responders. Again, not to certify them, not to teach them allopathic medicine, but to have them as first responders on highway trauma care and other trauma that happens in rural areas. Why disruptive innovation? Life has taught us that disruptive innovation changes history. And EMS needs to have more and more disruptive innovation. And so we want the government to support these disruptive innovations. As a small organization, Lifeline Foundation, this series of disruptive innovations has given us a status perhaps globally of being the only organization to work at the crossroads of road safety, public health, emergency medical services, industrial emergency medical services also. Venu has been a huge part of our work in industrial emergency medical services, and we are looking at getting emergency doctors into industries. You'd be surprised that, or pleasant to know that NTPC, National Thermal Power Corporation, has started to recruit emergency physicians across the country. Reliance has started to do it, and I'm told that Mr. Mukesh Ambani's family wants 10 emergency physicians to travel with them when they go global. So that's what the stature of emergency medicine is in India. You know, they're not wanting physicians, they're not wanting surgeons, but ER guys and emergency guys to travel with them. And that's a change that's come in the last 20 years. It's all because of all of us have been co-crusaders. But frankly speaking, for me, all this started off because of this lady here. I always tell it's a great thing to be married, but it's greater to be married to a very adamant woman. And when we had this accident in '99, left to die on one of India's busiest highways for 4.5 hours, when we survived it and time spent in the hospital is when Sushmita made this remark, we were lucky to be alive. Let's ensure others don't die on the highways. That simple thing became sort of a mission for us, driving change, fighting an inertia-driven system, and creating India's first highway helpline number, which then became something that Mr. Ramalinga Raju at Satyam, history might judge him differently for other things, adopted that model and made it a 108. Thank you, Sushmita, for being the backbone and a co-crusader. Sincerely speaking, I'm not a believer of rebirth, and so I strongly believe that there's only one life to live. And as Mrs. Melinda Gates, while mentoring me, said, leave a legacy. And that's what I expect every emergency physician, young and old, to leave a legacy. It's very important. We all say that jo hona hai hoga, it is destined, I can't change. I was also fortunate to be mentored by a gentleman called General Colin Powell during my Asana fellowship. And he had this remarkable statement to make. And I tell everybody, he said there's nothing called destiny. Your destiny is to make your own destiny. And I see this young group of people wanting to do that. Go ahead and change the world. That should be your guru mantra. Having said that, my generation of Tamurish, Venu, Narendra, Sachin have done a bit, and it's for this younger generation to carry it forward. It is time to hand over the baton to this young generation. As they say in the US, it's time for us to be grandparents in emergency medicine. But standing here, I realize one thing that most emergency physicians don't realize. We think education, technology, training, the 108 system, government and its bureaucracies are the pillars of emergency medicine. There's one more pillar, corporate leaders. If you did not have a Ramalinga Raju, if you did not have a Dr.Azad Moopen, we would not be here. Dr. Venu would not be on the International Emergency Day conducting this. So never forget that with gratitude, that there are corporate leaders, and that's why we get to save lives. It's a legacy they are leaving, and really thanks to them. Lastly, as I end, you're not going to like it, the younger generation, but I need to talk about an issue that bothers me about young physicians. EMS is a team effort. It's like a team sport, like cricket and football and hockey. And I feel I'm lucky that I grew up in an age of pre-social media age. During our days, when we had lesser workloads in casualty departments, we used to sit at a table and chat, talk, know each other. It sometimes stuns me when I enter an emergency room in hospitals that when there is a lesser workload, 4 or 5 students, faculties, teachers, nurses are sitting at a table, but they're peering into their smartphone. That's not how we build a team. Steve Jobs once said that lead by shining examples, learn from shining examples. And I would request everybody to learn from a shining example of Dr. Venu. What a team he has, and he did not build it over smartphones. He built it with a network. If the future of emergency medicine has to go ahead, teamwork is important, and we need to learn from Dr. Venu and his team. Thank you once again for having me here.
Sir, I would like you to stay back on stage, and ma'am, you as well. I would like to call upon Dr. Abraham Mammon, Chief of Medical Services, Aster Calicut, to honor these two beautiful people, and it would be great if you also could speak a few words.
Thank you, sir. Thank you, ma'am. Okay. To whom? Continue. Okay. Trust the vibes and energy doesn't lie. And we have one such man amongst us with energetic personality whose energy has created dynamic changes as a leader. He is none other than Mr. Farhan Yasin. Regional Director, Aster Kerala and Oman Cluster, Mr. Farhan Yasin is a passionate leader with strong managerial skills. He's played a pivotal role in bringing Aster memes to the forefront of healthcare delivery with utmost patient care. He has proven track record in achieving growth objectives in a timely manner all over his career. Under his stewardship, Aster Memes has succeeded in spreading patient care to both urban and rural areas throughout Kerala and Oman too. He extensively devotes his spare time in learning modern management practices and truly ensures its application for planning innovative strategies. I welcome you, sir, on dais to share your wise words with us.
Thank you very much for the beautiful words. Actually, as a non-medical person, I honestly say that I am not qualified to stand here. But with the help of Venu sir and his team, I am so much happy that we conducted such a great event here. And I would also like to thank the operations team led by Mr. Lukman and his team members who were working very hard 24/7 for past 2 months to get this into reality. So when we talk about the emergency medicine, I should highlight 2 major points that happened in last 2 to 3 years. You all might be remembering an incident that happened in Calicut, Karipur airport. The flight crash event. And at that time, there were around 3 hospitals, major hospitals in Calicut were standing in forefront to treat all those patients during the peak time of COVID. That was the important point that I need to highlight. During the peak time of COVID, entire doctors, paramedical staff were in full PPE, and at that time we faced that flight crash, mass casualty in our hospitals. It was the important time where the public understood the importance of emergency medicine. And we were very happy to say that we saved almost majority of lives during that time. So during that time, under the leadership of Venugopal sir, we realized that it is time to expand our services in primary and secondary care hospitals. So we decided to start emergency department in small sector hospitals. And within last 1.5 years, we started around 7 emergency departments in 7 hospitals in North Kerala. And we are going to expand it in southern part of Kerala. This year, we will be starting another 10 more emergency departments. And we have a vision to start this not only in Kerala, but to other states in India, under the leadership of the great visionary leader and my role model, Dr. Venugopal. And one more point I need to mention here. We were all facing an acute shortage of beds during the COVID time. We were having instances that 15 to 20 ambulances are waiting in front of our emergency department, and we were not able to arrange beds for them. And we were providing treatment inside the ambulance. At that time, we decided to start 120 acute care beds, converting the parking lots of our hospitals. Within 5 days, under the leadership of emergency medicine, we converted the parking lots of all 4 major hospitals of Aster hospitals in Kerala, and we started around 150 beds, acute care ICU beds with all state-of-art facilities in just 5 days. And the entire patient load was managed by team emergency medicine. And this was one thing I should highlight here. And we saved a lot of lives. So hats off to Venu sir and his team. Not only Venu sir, we have Dr. Fabit here, we have the emergency medicine of all the major hospitals in Calicut. Anyway, together we were able to save many of our lives in Kerala. Thank you very much for inviting me. Thank you very much for giving me time. Thank you.
Thank you, sir. Technology is best when it brings people together, and with the help of such technologies, we have traced few diamonds across the globe who reflects their shine wherever they go. And so, to make this evening more lustrous, I would like to invite Dr. Kate Douglas, who will be addressing us online. Dr. Kate Douglas is an associate professor of emergency medicine and global health at George Washington University. Under the leadership of Dr. Douglas, India's 10 postgraduate emergency medicine education programs across the nation of India, graduating trained and qualified emergency physicians to address India's severe emergency medicine human resource shortage and injury epidemics.
Good evening, everybody. So, is that echo true, or is it just what I'm hearing? I'm going to carry on, and I hope that you guys can hear me. I really wish that I could be there in person. And on behalf of myself and my team and all of my colleagues from the George Washington University and the Reagan Institute of Emergency Medicine, I am really honored to be able to share a few remarks and to speak on behalf of our group. And as I said, I was really hoping to make this trip happen, but instead we will land on the benefit of technology to be able to be together, at least virtually, for a few minutes. If you could mute the other microphone on Zoom, that might make it easier for me because I'm getting a big bit of feedback. I have shared some slides, and I don't know if you can see them, but one of the things that I would like to just start with is something that I will always remember. You know, we've been working with Dr. Venu and the team and MIMS and across the state of Kerala for the past 15 years. It's one of our first partnership programs that we started back in 2006. And I can honestly say that this has been one of the most incredible journeys to be a small part of it. Has been amazing. I'm really gonna hold on one quick second for a technology issue. So every so often after a student graduates from one of our programs, they call me up in the fall or a couple months after they've graduated, and they tell me this story of starting at a new hospital where there hasn't been the reach of emergency medicine yet. And what they say is something along the lines of, Dr. Kate, I went to this new place, and the first thing I noticed was that their emergency department was called a casualty. There we go. Thank you for muting. I can now not hear myself echoing. This story is repeated over time where somebody leaves a program or a hospital where the reach has already gotten, and they go to a new place. And when they get there, they realize that there hasn't been this start of emergency medicine. So there's a casualty ward. They call it the casualty, and everybody, even in that little micro environment, has gone there with the expectation that the patients will not survive. And that's why it's called the casualty ward. And what I can say is that these people that go out to those places, what they do, they're like, the first thing I did, I changed the name. I changed it to an emergency department. And that's like their first step. And then the cascade of teaching and training and change and progress starts from there. And that cascade increases the ability to care for critically ill patients. It saves lives. It changes the perception of what can happen in a hospital, what can happen when there's an unanticipated event, whether it's a traumatic event or a acute coronary syndrome, a stroke, what have you. these acute events are cared for by a person who has training. That person takes the name and changes it from casualty to emergency department, takes the system and changes it from chaos to coordinated, takes the approach and takes it to a team environment. And these people then start training the staff, training the nurses, training the paramedics, training the lay people. What I can see and what I can say across Kerala is that the leadership that started with Dr. Venu and has come from the kind of heart of the emergency medicine programs in Calicut and has come out like a what they call like the spoke and hubs model, where you start to see these places popping up all over the state, is that it starts with these individuals who have a passion for care, a passion for teaching, a passion for saving lives. And it has grown exponentially over the past decade and a half. And much of that is due to the leadership from Dr. Venugopalan. You see, these individuals go out and then their team, they save a life. And the people in the hospital, they say, that person, they brought them back from the dead, like it's never happened before in that place. And the environment starts to change. And all of a sudden, it goes from a place where people go to die to a place where people's lives are saved. And that is a huge transformative change, which has taken place in large part from the immense efforts for teaching, training, and emergency care that comes from the leadership of Dr. Venu and his teams. So like I said, this is cascade training. So of course, you know, there's a lot of emergency medicine training at the physician level, but that has not been it's been far from the only emphasis and far from the only impact. It's the system. It is the system from the very beginning of layperson CPR and a system of response from the EMS all the way into the hospital care for the nurses, the paramedics, the physician care. And this chain of survival has impacted so many lives. And I think that that's the thing. When you're working in an emergency department, your team comes together and you really focus on saving a life. And I think as you go on in time, you remember and you think, okay, these were the great cases or these were the lives saved. But what I don't think we're able to count is the number of lives and the number of families and the number of people impacted by this incredible cascade of training that has happened. It's impossible to quantify this impact, but we know that it is absolutely astronomical. And some of the quantifications that have been done have reached, you know, like little things like the Guinness Book of World Records and stuff like that. And what I can say is that is just like a small little sliver of the amount of work to build emergency care in Kerala. And it has been an absolute honor to be a small part of that effort. And this is just a quick quantification of some of the outcomes and impacts. And again, these numbers are only there to really identify and suggest that any physician training program, which of course our core partnership that we have had with the DM Academy, Dr. Venu, his teams, and the physicians across Kerala, and then beyond that, obviously, to many of the states across India, which most of you know, it only is a beginning of a quantification of the impact of these programs, because of course these programs train physicians to practice emergency medicine. And the impact of that then kind of creates this cascade effect, which goes on to impact the people around them, the departments in which they work. It impacts the science. We have people who have come through our programs, have changed the science of resuscitation, changed the science and the practice of emergency care, ranging from pre-hospital care to acute care of patients coming in various departments around the country. Community outreach is a huge piece. We can only save people if when an event happens, they recognize the event, they're transported to the hospital, they're given the appropriate pre-hospital care and immediate resuscitation from bystanders, followed by appropriate care when they reach the actual facility. And so what we have never been able to do is count the number of patients who are impacted. But I also think that if you think, okay, I know one person, or I know how it feels when my family member has gone to an emergency department and their life has been saved, I think we can all know from an individual level the tremendous impact that this has had, not just on individuals, but their families, their communities, and the country and the world beyond. So it's not just teaching and training, though, and this is echoing the comments that other people have made throughout this this ceremony today, and I've been really happy to be able to join from afar. So thank you to everyone for making that a possibility. But you think about disaster preparedness, community awareness, teaching and training, surveillance. This picture is from that field hospital that was set up during the COVID pandemic. And what you see is okay, on a day-to-day basis, the care is different in the emergency department. And in true emergencies or true unanticipated events, this system and this foundation that has been laid, that has practiced these other events, that has practiced and prepared and thought about the things that might happen, is there and ready to respond in these moments of floods, these moments of the unanticipated, the Nipah virus, the COVID pandemic, all of the things that have happened over time. These effective responses to these events is built upon the foundation of solid emergency care at its baseline, which has truly and fundamentally changed the scope of medical care and changed the scope of preparedness and response. And as I said, it's really just an honor for us to have been able to be a small part of these efforts over time. This is my last slide, and when I was thinking about it, as I was listening to the presentations today, I think I'm going to start with gratitude. And my gratitude really kind of goes that on behalf of our institution, the many faculty and the many people who have been able to travel can contribute in a very small way. It's really been an amazing journey, and one that we foresee carrying on into the next years to come. The gratitude for the leadership, the partnership, the impact, which is really hard to quantify, the persistence. It's like every time we even we communicate and we engage, there's a new idea and a new opportunity, whether it's the expansion of the private-public partnership for pre-hospital care, or thinking about new ways to train new people and build upon the work that's already been done. I'm not going to speak to the ideas of workforce, and I'm not going to speak to the ideas of recognition or the amazing journey that has only just begun in terms of the emergency medicine recognition as a specialty. I think that from my perspective and from our perspective, there's just this incredible value and immense work and immense immense impact which has come from the work that has been done. It's been an incredible journey since our partnership started back in 2006, and really it's through the visionary leadership and coupled with humility and grace and a great sense of humor which has to accompany all of the work, that we've taken this journey and seen such an incredible impact. So I think with that, I'm going to stop the slides. I'm going to just say on behalf of myself, Dr. Jeffrey Smith, who's not here today, we can go back and think about Bobby Kapoor, who was one of the instrumental leaders and visionaries for this program, and all of the faculty that have been able to participate. Thank you. We wish we could be there in person. We will see you in person very soon. Congratulations on an incredible event that you're organizing, and best of luck with the rest of the conference, and we'll talk to you soon.
Thank you very much, ma'am, for your valuable input. In order to be irreplaceable, one must always be different, and that difference can only be made when one starts working in direction of positivity with all the willpower one imbibes. I would like to introduce now one such man who made difference across the globe, and his positivity of his work and vibration reached back to his homeland, India. Benefiting every year lots of medical graduates, the man is none other than Dr. Parag Singhal, MD, MPhil, FRCP, FACP. He is Executive Director of BAPIO Training Academy, along with Honorable National Secretary of BAPIO. He is currently an Honorable Professor of Medicine at University of Bolton, Visiting Professor at Medicine at University of South Wales, and Specialist Advisor at CQC. Senior Examiner of Royal College of Physicians UK, founder and director of BAPIO RCPE, Indo-UK 2+2 program. Appointed as a clinical academic advisor to the American University of Antigua, PhD CCI, Concede member, BMA, South Wales, UK. Member of Indo-UK Task Force for Health. Sir could not join us today, so he has sent some small video message for us.
Hello, I'm Parag Singhal. I'm endocrinologist in Bristol, United Kingdom. I'm also Executive Director of BAPIO Training Academy, which is now partnering with Aster group of hospitals and setting up emergency medicine training hub in Calicut. On behalf of BAPIO Training Academy, I wish to congratulate Venu and his team to have put together such a wonderful program for the trainees. And this conference is all about how to learn emergency medicine and the nuanced approaches to emergency medicine. And this will set the scene beautifully for our trainees, current, future. And this is only going to go further and further. Once again, well done, Venu. Thank you very much.
The purpose of life is not to be just happy, it is to be useful, to be compassionate, and to have it make some difference that you have lived and lived well. I would like to introduce now Dr. Shweta Gidwani, graduate from St. G.S. Medical College, Mumbai, India, after completing her emergency medicine and critical care training in
Greetings from London, and congratulations to the organisers for what I understand is...
She was awarded a fellowship to the Royal College of Emergency Medicine, UK. She is a practicing emergency medicine consultant in Chelsea and Westminster. NHS Foundation Trust, London. She also has 18 years of working experience in the NHS. She is a core member of RCEM, Global Emergency Medicine Committee. In 2013, she was awarded to become adjunct assistant professor at George Washington University in Washington, D.C., and has worked with a team to scale up emergency medicine training in India. She also works on the health system strengthening and capacity building in emergency medicine in Uganda. Ma'am couldn't join us today, so we'll be playing her pre-recorded message.
Greetings from London, and congratulations to the organisers for what I understand is Asia's largest emergency medicine conference. Now, breaking records is nothing new for the dynamic emergency medicine leaders at MIMS, under the visionary leadership of Dr. Venu Gopalan and Chairman Dr. Azad Moopen. From Guinness Book of Records to the most number of BLS providers, to large-scale mock and live disaster drills. In the 12 years that I've been associated with emergency medicine development in India, the scale, the quality, and the impact of emergency medicine capacity building in this region has been nothing short of impressive. So as I was reflecting on what were the key drivers to your success, I thought it actually boils down to to three main things. Transformative leadership. I have seen true transformative leadership in action here in this region under Dr. Venugopalan's leadership, along with Chairman Dr. Azad Moopen. They realized the need for emergency medicine care to save lives in this region. So they developed a joint vision and strategy and have been able to implement this such that today emergency medicine service is delivered at scale to the masses in this region of Kerala, making it, in my view, one of the safest places to have an emergency or an accident in India today. And in doing so, they have done this without being inwardly focused, but have reached out and sought partnerships locally, nationally, regionally, and internationally so as to create a true network of emergency medicine care in order to save lives in this region. The next really key feature has been this singular committed focus to mass community mobilization and awareness, from roadshows to mock drills, sensitizing the public about the need for emergency care, the need for trauma and disaster medicine, so that they in turn might advocate for better care, is nothing short of genius. And I think all of us have lessons to learn from this approach. And finally, none of this would have been sustainable if it wasn't laid on the solid foundation of high-quality training at scale. The emergency medicine doctors, nurses, and paramedics trained at MIMS DM Aster have been pushed to work hard, to train hard,